Hi, this is Dr. Charles Nagel. I am an orthopedic hand surgeon at Ortho Texas, and today we're going to talk about D. Quervains tendinitis. D. Quervains tendinitis is a fairly common wrist problem, and most people complain about pain along the thumb side of the wrist. It can be very sharp pain, and it can be quite debilitating in some individuals. Thumb motion and wrist motion at the same time do seem to aggravate symptoms. The causes of this are varied, including diabetes and thyroid problems can increase the risk of this problem, but also trauma, repetitive trauma, sometimes just repetitive use can also lead to this process. People who have this problem usually complain about pain along the thumb side of the wrist, and there's a tunnel through here in which two tendons travel, and they can become inflamed, as we had spoken about before, either through trauma or with repetitive use, but also some medical issues can increase your risk of it. And frequently we can see this in people who are taking care of young individuals, babies and infants, that require a lot of lifting with their thumb abducted away from their hand. So in addition to pain complaints through here, most patients will have soreness or tenderness to touch in this region as you're touching over the tendons. In addition to that, there are some maneuvers that you can do to see if it increases the individual's discomfort. For one is called a Finkelstein's, in which the thumb is bent and then the wrist is only deviated. Sometimes this causes really sharp pain through here, and that would be a positive test. Another test that we ask the individual to do is to pull their thumb all the way back to their wrist as far as they'll go. Frequently this will cause pain in this area. If it's made worse by actually causing pressure here, then that's a sign that maybe instead of one or two tendons, the individual has a variant and actually has two separate tunnels. These individuals actually respond to non-surgical treatment not as well as people with just a single tunnel. Treatment consists of wearing a thumb spica brace. We wear this most of the day and night, but we do take it off to maintain range of motion of the wrist because we do not want to add stiffness to this process. The second thing is something for inflammation, and frequently we will do a cortisone injection right into the tunnel here, and that we'll do that, and we'll see the person back in 3 to 4 weeks. If they're doing much better, then we start getting out of the splint or the brace and start doing range of motion, some strengthening, and return to our activities. If it's still sore through there, then we do a second injection with additional splinting. If that is unsatisfactory, then we actually, in a surgery that we just put the arm to sleep, we make a small incision in this area and we open up the tunnel where these tendons travel back and forth. That surgery is a very successful surgery. You can write and use a computer from the first day of surgery, and by 8 weeks you're back doing everything that you want to do with the hand and wrist.